Have questions about your health? Well, the doctor is in. Dr. Janet Seabrook, Community HealthNet CEO and all-around health expert. Dr. Seabrook wants to help because your health matters.
All right, did you hear that? Dr. Seabrook wants to help because your health matters. And it's a serious issue, and each month the doc sits down and has some conversation regarding taking care of yourself and some good tips and techniques, and then they tell you about what's going on in the community. And today I'm excited about a lot of things. In case you missed it, she's going to be talking about that as well. So, and talk a little bit about lupus. So with that, I'm going to say good morning, Dr. Seabrook. But before I do, I need to let our listeners know that the views expressed by the hosts and callers of this show are not necessarily the views of WLTH Radio Management, owner, and sponsors. And I also have to say good morning to the sidekick, Mr. James. How you doing, Doc?
I'm fine. Good morning, Natalie. How are you?
I'm doing great, and I'm happy to see you.
Good to see you, too. It's good to be seen.
Absolutely. Absolutely. Yeah, you've been a busy lady.
Yes. I'm trying to wind some things down, but it's hard trying to do so many things at once and accomplish so many things. I have all of these goals set, keep a to-do list, always trying to check off as many as I can throughout the day, but it does get difficult sometimes.
Yeah, because not only do you check them off, but you keep adding stuff to that list.
That's the problem.
Well, I want to say congratulations, because I am so excited about just everything that went on with the grand opening, and I'm going to let you reveal it, and I'm going to hold my composure, because it still seems like it's just like a dream come through, and so much going on, and the mayor was here and she was talking about the event. So tell our listeners what they missed, or maybe some of them did get a chance to go.
So on June 27th, so last month, we held an open house, a ribbon cutting and an open house and tour of our newest facility at 3503 Martin Luther King Drive in Gary, directly across the street from the Career Center and now 21st Century School. So we were real excited about moving into a new community, a new neighborhood, and actually providing new services for our patient population. So besides the general family medicine and pediatrics, OB, and behavioral health, will also be providing optometry services as well as dentistry directly from Community HealthNet employees. These won't be contracted people. This won't be another company. This will be Community HealthNet's dentist and Community HealthNet's optometrist. So we're real excited about that. We're in the interview process and stages right now. We have some of our providers that are currently at our other locations that will be providing services at the new location, especially family medicine. So we're just excited about it. We probably had close to 250, 300 people that showed up throughout the day on June 27th. We were able to roll out our mobile unit, which has 2 exam rooms, and we'll be able to take the unit to different locations to be able to provide medical services. We're going to be announcing some new partnerships today, and one of our biggest partnerships, we're working with the Gary School Corporation to make sure that the students are able to go back to school healthy and have all the vaccines and the back-to-school physicals that they need. We're going to be using the unit throughout the year, at least while the sun is shining, no snow on the ground, to be able to help provide health services to schools in the Gary School District that are in need. And then we have a 10-passenger vehicle, minibus, and we're going to be using that to transport patients and students to the various locations, so we can make sure that everyone gets the services that they need and that they deserve to have. to be healthy and to be viable in the community so they can stay in school and parents can continue to go to work and not have to miss work to take their children to the doctor. So we're just real excited about that. And then we have a huge event coming up this Saturday with the city of Gary at the RailCats, the annual back to school at RailCats Stadium, where typically there are over 2,000 people milling around the stadium, and we do back to school physicals. There's backpacks, there's various vendors, there are different city services that you can sign up for. It's just it's so much going on. Music, face painting, backpacks, school supplies, vouchers for school uniforms, sports physicals, you name it, it's there at RailCats Stadium. So that's going to be this Saturday, July 27th. And James, you have to tell me the time because I know it's changed a couple
8 to 1.
So 8 a.m. to 1 p.m. Saturday, July 27th at RailCats Stadium.
So James,
Giveaways from 8 to 11.
8 to 11.
Mm-hmm.
Okay, so I'm glad you quantified that because last year I showed up and it was like after 11 o'clock I had something. I said I'm going to go do this early. If you are not there at least 1 hour after the whole thing starts, you might as well just stay at home.
Right.
Yeah.
But the immunizations.
The immunizations, we're going to be doing those throughout the day. But you're correct. All of the vendors come with things to give away. And I tell you, there's typically 1,000 people waiting for the doors, for the gates of the stadium to open up. And that first wave of that first 1,000 people, usually everything has been given away by 11:30. So I urge people, and I know it's early for Saturday morning, but if you would like to participate and have those giveaway items, which are typically very valuable and very instrumental to help you not have to put out so much out of your pocket at the beginning of school, I urge you to come as early as possible. So 8 a.m. to 1 p.m. on Saturday, July 27th at RailCats Stadium. But from 8 till 11, that's when all the goodies are going to be given away.
Now, one of the things we have to stress, because you are giving away immunizations and you're also you're giving immunizations and you're doing the physicals. They must bring their immunization record.
Yeah, that's the only way that we can give it because we don't know what you have and what you have not had. And we definitely don't want to duplicate, and we want to make sure that you have every vaccine that you need for your appropriate age. So if you don't bring the shot card, unfortunately, we cannot. We're not allowed. We cannot give you or your child immunizations without some knowledge of their shot record.
Now, here's the other thing. If you move from a different area and you just come here, how can I get that shot record if I forgot to bring it, if I'm from another state or let's just say another location within Indiana?
So within Indiana, if you don't have a copy of your child's immunization record, you should be able to go to your local health department. There is a registry, an immunization registry, and you can request that it be printed out. All you need is your child's name and date of birth, and they can look in the system and print it out. Unfortunately, we won't be able to access that at RailCats Stadium. It's very tedious and it takes time. So we're imploring everyone to please bring your child's up-to-date immunization record with you when you come. Otherwise, we will not be able to immunize.
Now, in terms of the physicals, is this just a physical or is it a well-being checkup or anything like that?
What we're actually doing there are some children that are required to have back-to-school physicals to return to school, and then there are others, they may have their sports physical forms with them. So these are the students. If you have a form that needs to be completed before you can enter school, these are the students that we really want to reserve those exams for. If you're not planning on playing any sports and there are no restrictions to you being able to go to school on the first day without a physical, then you're fine. But if you are going to play a sport and your coach has said, he or she has said, bring this form back on the first day of school, completed, signed by your doctor, then those are the students that we want to see. Or if you have a form that says, please complete this physical form to return to school on the first day of school. Those are the students. But if you don't need one, please don't take one of the wristbands just to be getting your child a physical, because it's taking away a service from someone else that may need it to play sports during the year or to get into school.
Now, I've heard this commercial before. I've had this discussion before. The human papilloma virus. And I think you and I have even talked about that.
Yes.
Is that something that you will be able to administer there? Because I think it's within a certain age group that you have to get this vaccine.
Right.
Okay.
So it's up to age 26 now,
Okay.
and it's girls and boys for the vaccine. And so it will be available at the event, but typically it's not mandatory to have that vaccine to return to school. So we really try to focus on those vaccines that you have to enter into school. But if a parent requests it, typically we will have a couple of the HPV vaccines out there. But that's really a vaccine that we like to have the conversation with the parents inside of the exam rooms. But if the parent asks for it, which most parents don't, because in their mind it connotates sexual activity. So there's a lot of other discussion that needs to go on with the giving of the HPV vaccine. Okay. I wish they would make it mandatory so we can just include it in as a part of those age-related vaccines.
And so as we talk about this, and I'm awfully certain, no doubt in my mind, people will be able to pick up information regarding the vaccines and all of the other things that are involved with that.
There'll be so much information available, not just from Community HealthNet, but from other vendors. You'll probably be on information overload by the time you get finished.
And I'd rather be on overload than anything else.
I think what's making me the happiest this year is this is the first time that all of the back to school events are not on the same day.
I know.
So I'm excited about that. So it gives more people the opportunity. You don't have a lot of harried parents running around trying to run from this place to get a voucher for uniforms, and this place running to get immunizations, and another place to go and get the backpack that's full of full of school supplies. So I like this year the way it has been coordinated, so there's not that overlap that you don't have from 8 to 1 o'clock.
Yeah.
5 different events going on at the same time. And what happens when that does happen like that, we are hard pressed as an organization to attend all of those events. And so I like the fact that this year they're spread out, started in July and into the first couple of weeks in August.
Have questions about your health? Well, the doctor is in. Join Community HealthNet CEO and all-around health expert, Dr. Janet Seabrook, every fourth Wednesday on WLTH 1370 AM. Don't be shy. Call in and ask your questions. Dr. Seabrook wants to help because your health matters.